610. Before we get into what I've been working on throughout the course, I wanted to take a quick look at the knowledge to action process. The knowledge to action process outlines the process I underwent in order to address an issue in healthcare and propose an education intervention. So, the knowledge to action framework was originally developed in 2006 by Dr. Ian Graham and is based on over 30 change theories. It provides a structured approach for making change, including a 7-phase action cycle that moves knowledge into practice. The knowledge to action process has two main components. The first component is known as the knowledge creation process. This process is demonstrated in the center of the diagram. It is made to look like a funnel because it gathers all the knowledge available on a topic, for example, research, summarizing the knowledge, and uses that to create a tool that can be used to improve healthcare. The second main component is the action cycle. This consists of the 7 remaining phases that must be addressed when using the knowledge to action process as a guide. Now let's take a look at what I've been working on all semester. So I looked at how we can reduce sepsis-related mortality. So sepsis is a deadly medical condition that affects millions of Canadians every year and is responsible for 1 in every 18 deaths. Sepsis is defined by the Center of Disease Control as the body's extreme response to an infection. The body responds to infection by triggering a chain reaction to try and fight off potential infection. It is a life-threatening medical emergency. There are certain patients who are already at higher risk for developing sepsis and are likely to have a more fatal response. This population includes adults 65 and over, patients with weakened immune systems, patients with chronic illnesses, and patients who have recently recovered from sepsis. The treatment for sepsis is antibiotics, and when administered quickly, it can drastically change the outcome for that patient. In order to determine if the early administration of antibiotics significantly reduces sepsis-related mortality, the following PICO question was formulated. In adult patients over the age of 18 in an acute care hospital setting, does early antibiotic treatment reduce sepsis-related mortality? A literature search was then done to appraise the existing literature and develop an education intervention. Several online databases were searched for literature, including CNAL, PubMed, Sage, ScienceDirect, Athabasca Library, Gale, and Ovid. Some key terms such as sepsis, sepsis treatment, acute care, reduced mortality, early treatment, and early antibiotics were used to find relevant literature. 4 studies and 1 systematic review were selected to be critically appraised using the Critical Appraisal Skills Program to assess for validity, impact, and applicability. So what were the results? 3 of the retrospective cohort studies found that delaying the administration of antibiotics increased the rates of in-hospital mortality from sepsis. 1 study followed patients for 1 year after discharge and found that 19% of patients died within 1 year, and with each 1-hour delay of antibiotic administration, there was an associated 10% increase in the odds of mortality. Overall, early antibiotic administration in patients diagnosed with sepsis is proven to reduce hospital mortality by an estimated 33%. In light of COVID-19, a virtual education session was planned for RNs working on acute care units such as the ER and ICU. The goal of the intervention is to educate RNs on how to recognize sepsis early, the atypical signs and symptoms, emphasizing the importance of communicating their findings with their team and the impact of early treatment on patients to ultimately reduce sepsis-related mortality. There will be 2 education sessions offered per unit, and for any staff who are unable to attend, all education materials will be sent via email. The education session will also have an interactive component such as case studies and clinical simulation. One major barrier that was identified when planning to implement a virtual education session for RNs was the potential lack of attendance due to shift work schedules. Many RNs work 8 and 12-hour shifts rotating between days and nights, which could potentially be a barrier while scheduling the education sessions. In addition to this, another potential barrier is the effect of COVID-19 on the mental health of nurses. Nurses reported to struggle with higher levels of anxiety, depression, and increased stress levels during the pandemic. Poor mental health can lead to a lack of interest, lack of engagement, and lack of enthusiasm in learning. In summary, the knowledge to action process was utilized throughout this course in order to develop an education intervention that targets RNs and sepsis. A PICO question was asked, and research was done based on the PICO question. A critical appraisal of literature was completed and confirmed that when antibiotics are delivered early, there is a significant reduction in sepsis-related mortality. Therefore, the early recognition and early treatment of sepsis is crucial knowledge for RNs working in acute care centers. Thank you.